I'm very excited about it. The whole campus is excited because it gives us an opportunity to showcase one of our superstar faculty. And that means a lot because when one of our faculty shines like that, it means that all of our faculties, they begin to rise to another level. And it brings great attention to the university.
As part of her work, she's had this deeply felt desire, I think, to help those in need of health care, but who are unable to afford it, and who live in communities of lower socioeconomic backgrounds.
Dr. Sylvia Flack grew up in the small town of Spindell, North Carolina. Her father worked at the local hospital, and as a young teenager, Dr. Flack saw firsthand some of the issues in healthcare with minority communities.
I worked at the local hospital there because my dad was an orderly there, so you followed. And I worked as a maid because I couldn't work as anything else. And there was a place called the Annex. The Annex was where black patients were placed. And even as a maid, when I would work on that unit, I did things that nurses did. The regular nurses would bring me the medicines and tell me to give it to the patients. And I knew this was not what's supposed to be. I knew that.
Dr. Flack graduated from Winston-Salem State University with a bachelor's degree in nursing in 1968. She then received her master's from the Medical College of Georgia and her doctorate from Virginia Tech. Soon she returned to Winston-Salem to begin her work in education and public service.
Cleon Thompson, Chancellor Thompson, brought me here in '89 because the university was losing its nursing program. And I'm an alumnus, but not only that, I knew the significance of a nursing program to a particular area and how important it was that this university did not lose that nursing program. So that's where it all started.
She served as Dean of our School of Health Sciences. She was Special Assistant to the Chancellor at one time, and now she's Director for Center for Eliminating Health Disparities. And that work has been so much a part of my own experience as a psychologist and a behavioral scientist. And so in many ways, Dr. Flack has been a mentor to me personally in the work that she's done.
We talk a lot about equity and, just the daily, it's like, well, exercise. Exercise is easy. You can go out and take a walk. But you can't go out and take a walk if you don't feel safe in your neighborhood to go out and take a walk. And I hadn't really thought about it until someone like Dr. Flack had really said, no, let's take a deeper look at this issue. And it was through her leadership that our entire school is looking at health disparity.
Dr. Flack helped us develop a program called How Was Your Heart Project. I got very concerned about heart disease, and Dr. Flack was working with health disparities. And so she helped us develop that, and with that we developed a play called Dr. Blockhart's Family Practice. And we began doing the play at different churches. I guess we've now done it at some 51 or 52 churches. Plays about 30 minutes to 2 hours long, just depending on the audience.
The African American population, Hispanic population, oh my goodness, and the American Indian population experience more diabetes than, again, the white population. The white population in this country enjoys better health than all other populations. And so they become the benchmark we compare. But why do they do that? Is the question. Why is it that there's such a disparity? And when you drill down in it, when you start looking at it, it has a social connotation.
She connects people for good reasons and good causes and makes sure that the work gets done. And so when I met Dr. Flack, it was one of those things for me. I knew that she could help, immediately seeing her. And as I was giving her my presentation, she stopped me. She said, I'm going to help you. This is great for the community. This is good for children. This is good for families. And so Dr. Flack then has been connecting me with people to make a difference in the lives of children and families.
When you really look at it, you're looking at health, which undergirds every other institution in this country. How can children learn if they're not healthy? How can people work if they're not healthy?